Greetings, everyone, and thank you for joining me on this episode. I'm really curious to know what your thoughts are on this question. How many times do you think we should explain terms or define public health to the communities we serve, to the general public, before they get it? Or we think that, we've satisfied, given them an answer to their question and we've educated them. Do you think it's once, twice? What are your thoughts on that? And I'm asking that question, but I really think it's a bit of a trick question. However, we're kind of following a pattern like that, I think. When I say we, I'm really thinking of a public health industry. I think there's a lot of opportunity for us to improve how we communicate public health to our colleagues and to the general non-scientific population of people who aren't in the industry of public health and are really genuinely curious to understand. So, I'll give you an example. If you're on social media or if you're at say, a community led event, we have so many opportunities to help people understand what public health means, to provide value. So, we first have to value what we do in our work, and then we relate that value and how we explain what we do to the non scientific or the non public health industry population, right? This is something we can practice amongst ourselves. Interdepartmental organizations can have a practice of explaining and expressing what public health is and what it means to non-scientific people. It's separate from how we talk about it amongst ourselves and we talk about our little silos and people, but really practice how we define public health. I think it's important because we miss that all the time. It's interesting to me because I watch people's reactions a lot to public health, and we do listen. A lot of times we just don't respond when the conversations come up. We have an opportunity to educate or explain, and some of us really do this well and we really try. But I think this is where a lot of the change that we want to see and the shifts that we need to make really start by clearly and simply defining. And I think we need to put it on repeat. Think about the dozens of commercials that are going on right now that the jingle will get stuck in your head. We want that effect for people to really understand what we do. We don't want it to annoy them, but we do want it to just be a commonplace understanding. But in order to get there, we have a lot of conversations that need to happen and a lot of conversations that need to be shifted from the way we've had them before. So let's give an example. When you think about how many times, how long does it take to engage in a conversation before somebody understands? Let's like switch it around and think about how we are in different situations. So there are times when we know exactly what we want. We walk in a store, we get it. We don't need to look around. We really don't need much help. Maybe what aisle can I find this item? And to give you an example, I'm an Apple person. I like Apple products. So, if you're listening to the podcast and not watching this video, I'm holding up an AirPods case. I like using AirPods, especially when I'm in the office. I use them for Zoom calls or any meetings as I move around inside the office. I use them when someone gives me when I get a phone call. I don't want to hold my phone, so I'm going to use my AirPods. I just like them. I've used a lot of different products before, but these are the ones that I like. And these are my third pair, just because I did lose one. Anyway, that's another story. But this is my third pair. So when I lost my last ones, the first ones I still have. They're just old and outdated, but I use them as backup. The second pair I bought, something happened. I still don't understand what happened, but I lost one of them. And I tried to track it down. I just could not figure out to this day. I don't know what happened to it. But at any rate, after a while, I had to go and buy another one. So when I went into the store, I knew exactly what I wanted. I knew, well, I didn't have to even go into the store. I actually ordered it online. There was no shopping around. I didn't need to do any research. I just went to the site, ordered what I needed. It was shipped out to me. Done. I moved on. Same thing happened when it was time to update my phone. I This time I went in the store. I knew what I wanted, did the transaction and was out the door. There was nothing for me to shop. I didn't need to browse around. I didn't need to shop. I knew what I wanted. And, it was just someone that could help me with the transaction very quickly and move on. There was really no other questions that need to be answered. I didn't need a lot of explanation. But then there's other times when we go in a store, right? And we don't know what we need exactly. We kind of have an idea, So the person that works with us, and I'll use the example of running shoes just because I recently went through that and I've had a lot of conversations about this. So let's just say that you decide you want to take up jogging, like I may or may not have decided recently. But you go into the store and you wanna get a that it's important to have a good fit for your foot and, but you don't know anything else. You know that you don't if a good shoe can help reduce stress on your knees and joints and all that. So you wanna invest in a good pair. But you're not a running shoe expert. So you're not really sure what brand would be best for you. You haven't been fitted yet, so you're not exactly sure about size. You don't know what your gait is, all those things. So when you go into a store to be fitted, you want someone who's going to hear you out. You have a conversation where you kind of explain, well, I really do have some arthritis in my knees, and those things they're going to take into account as they kind of help you. And then they'll make some suggestions or recommendations, do some measurements. You'll go back and forth. Now you can walk in the store and have that walk in with that same intent to get a good pair of running shoes for yourself. And I can walk in the store with the same intent, but our situations are different. We may come from different fitness levels, backgrounds, understanding, arthritis level pain, all those different things all those things are different for us. So we need to work with someone who's going to explain. There's going to be a conversation. I may go in and it takes me 15 minutes to finally go through the assessment and decide on what I need. And it may take you 45 minutes to go through the assessment, get your questions answered, and find out what you need. So the person that actually is going to be patient, understanding, and have the conversation with us helps us get to the solution that we need so that when we make a decision, yes, I want to buy that, we walk out, we feel really good about that. Now, that's a very simplified example of this exchange. It could take 15 minutes, it could take 45 minutes, it could take multiple trips. For some of us, how many times does this happen? You walk in, you do the assessment, you get some questions answered, and then you go back and you think about it for a little while. And then maybe you go back a week or two later and you look and you browse a little bit and you shop around and you read some reviews and you talk to some people, and then you come back a month later and decide, okay, this is what I need, right? It's the degree that we're willing to have the exchange, share information, and help that other person understand is the measures the success, and it's a good example of the transaction in the conversation. So kind of back to my original question, how many times do we share the definition before they get it? We don't know because everybody is different. I just know that we need to be committed to whatever it takes, in it for the long haul, and be focused on the needs of the people in the population that we're serving and listening from them. Listening when they tell us where the barriers are and as they describe the challenges, because they may not know exactly what they need. They may not know even maybe the brand of shoe they've been wearing is what's causing a lot of the discomfort in their heel. And sometimes they don't know all those things until we start having the conversation. So bring it back to public health. Until we've had until we get to the point where it's a common everyday term and everyone kind of generally understands it, I think there's so many different levels of conversations that need to be had. As professionals, we need to be patient and understanding and caring and willing to engage in the conversation for as little or as long as is needed to get them to experience this exchange where we better understand them and they better understand us. It's not to get to the point to where we've shoved it down their throats enough that they get it, but it's really a two-way, because we're going to learn a whole lot about our community when we engage in that way, as much as they will be more informed and able to make the best decision for them toward the end, right? So, throwing all of this in here to just really reiterate how important it is for us to commit to these conversations that need to be had in a way that is not us force feeding anyone definitions and information like we've got it and they don't, we've got to get them there. That's not what it's about. It's this exchange. And in the process of this exchange, we get to learn a lot about the needs, the challenges, the barriers of each of the people. Each time we have this conversation, we walk away learning even more so that the next time we have the conversation, we are better equipped to go into the conversation. If we're not having these types of conversations, if it's always one sided where we're just posting and leaving, pushing the information, throwing out the flyers and walking away, we're never learning from the communities, right? So we have to be able to and be willing to engage so that we're learning, we're giving, we're receiving, right? So that we're getting better, we're improving as much as we're helping them improve. I hope this helps. I feel like this is something that it's so simple, it's so practical, it is overlooked, but it's extremely powerful and it is missing. So we need to, um, I encourage you to think about how you, no matter where you are on your journey from student level to senior level professional, I encourage you to think about how you can improve your conversations about public health and the projects that you manage and implement and the programs you design and create, all the way to the simple, everyday, casual conversations that you may have with your neighbor or your friend in a completely different setting outside of like your work setting, but maybe just in a completely personal setting. I challenge you to see just how you can bring these conversations, how you can engage in these conversations and hold space for these types of conversations and collectively be able to improve our relationships with the communities that we serve. All right. I hope this helps. I want to hear from you. Let me know what your thoughts are. Let me know what ideas come to mind for you. All right. All right, that's all I have for you. Just my thoughts. I've got a lot of thoughts, but I'm going to be sharing some of these with you as we continue on. Practical ways that we can improve, putting myself in this. That's why I say we. All right. Okay, everyone. Until next time, have a fantastic rest of your day.